Hello, welcome to today's webinar. Before we begin, we'd like to cover a few housekeeping items. At the bottom of your audience console are multiple applications which you can use. You can expand each event window or widget by clicking on the maximize icon at the top right of the widget or by dragging the bottom widget corner. This webinar is being recorded and will be available one day after the webcast using the same audience link. A copy of today's slide deck is listed in the resource list widget. It looks like a green folder at the bottom of your screen. If you have any questions for presenters during the webcast, you can click on the Q&A widget at the bottom and submit your question. We will try to address as many questions as possible during the webcast, but if a fuller answer is required or we run out of time, your question will be answered later via email. We do capture all questions. If you have any technical difficulties, please click on the Help widget. There's a question mark icon that covers common technical issues. Now I'd like to pass it over to Jody Schimel-Hyde. Jody, you now have the floor.
Thank you. Good afternoon to those of us who are joining from the East Coast, and good morning to those of us who are joining from the West Coast. Thanks for participating in today's webinar. I'm Jody Schimel-Hyde, a senior researcher at Mathematica, and I'm really pleased to moderate today's forum. The presentations you'll hear today will focus on the ways that employers can assist individuals with disabilities navigate barriers to work. For individuals with chronic disabling conditions, these barriers may be important when considering employment, when navigating a new employment relationship, or over many months and years with the same employer. For workers who experience the onset or deterioration of a disabling condition, these barriers may present new challenges to remaining in the labor force. Increasingly, policy attention is being focused on the role of employers in helping workers with disabilities remain in the labor force. Remaining attached to an employer when possible can reduce the likelihood of becoming reliant on federal disability benefits, and yet employers' responses to helping their employees manage or overcome workplace barriers may significantly alter the likelihood of maintaining that attachment. The presentations today will shed some light on the actions that employers can make to assist workers with disabilities and the reasons why they may or may not ultimately make those choices. Let me take a moment to introduce the presenters you will hear from over the next hour or so. The first presentation will be by my colleague, Purvi Sevak, a senior researcher at Mathematica and associate professor of economics at Hunter College. She will summarize work from her recent article in the IZA Journal of Labor Policy related to the role of workplace accommodations in the employment of people with disabilities. Purvi's presentation will focus on the perspective of employees, while the other two presentations will consider the employer experience. Next, you'll hear from Alex Gouldworth, another of my Mathematica colleagues, who will discuss findings from interviews she and her co-authors conducted with employers about the challenges associated with retaining workers following disability onset. Alex and her co-authors will be releasing a policy brief of their findings in the next week or two that will be available on the Center for Studying Disability Policy website. Additionally, their work will be featured in a forthcoming special section of the Journal of Occupational Rehabilitation that will focus on early intervention policies. I want to take a moment to thank the National Institute of Disability, Independent Living, and Rehabilitation Research. NIDLR supported both Purvi and Alex's projects through its rehabilitation and research training centers. Our final presentation will be by Kimberly Phillips, a researcher from the Institute on Disability at the University of New Hampshire. She will talk about findings from the National Employment and Disability Survey that was fielded to supervisors nationwide. UNH worked with the Kessler Foundation to develop and field that survey. And these presentations will be followed by a discussion that considers the overarching themes across all of the projects, opportunities for policymakers, and practical implications for employers and workers with disabilities. We are delighted to have Alan McLean, the Commissioner of Arkansas Rehabilitation Services, to provide his thoughts in these areas. And now, with that, I'm happy to turn things over to Purvi.
Thank you, Jody. I'm very pleased to be able to take part in today's forum to share findings from some research I've done on the role of workplace accommodations and employment of individuals with disabilities. I want to acknowledge my co-author, Priyanka Anand, who's now at George Mason University in Virginia. There's a rich literature framed in what is often called the medical model of disability that documents the health conditions, impairments, and demographic characteristics associated with stronger or poorer employment outcomes among individuals with disabilities. The medical model emphasizes characteristics of the individual, with interventions focused on curing or relieving symptoms of the condition or focused on other individual characteristics. Our study is motivated by a broader framework. This framework, the social model of disability, recognizes that societal factors may be equally important in the employment experiences of individuals with disabilities. These factors include workplace factors such as the physical structure or job characteristics, along with accommodations such as help with transportation. The existing literature provides some evidence that workplace accommodations are important but unequally accessed. The receipt of accommodations is associated with better employment outcomes, and among older workers with impairments, they're also associated with later retirement. However, not all individuals who need them receive accommodations. For an individual who needs an accommodation to receive one, requires some action by either or both the worker and the employer. Some workers may be more likely to ask for an accommodation, and some employers may be more proactive in noticing that a worker needs an accommodation. So it's not surprising that researchers have found that there is unequal access to accommodations. There are differential rates by race and education. And some research has also found that those with an assertive personality are more likely to receive accommodations. Our study adds to this literature by addressing 3 research questions. First, can accommodations address commonly cited employment barriers? Second, are specific accommodations associated with higher rates of job retention? And third, which subgroups of individuals with disabilities are less likely to receive needed accommodations? To address these questions, we use data from a survey we designed in 2014 called the Survey of Disability and Employment. The sample of the survey included 3,000 applicants to state vocational rehabilitation agencies in 2014. These were applicants to the agencies in Mississippi, New Jersey, and Ohio. We included individual applicants that were ages 25 to 60 to focus on prime working age individuals rather than the transition age population. This is a particularly useful sample for studying employment because by applying to state VR, these individuals have demonstrated an interest in work. The survey includes information on health and impairments, demographics and education, current and past employment, reasons for not working, and receipt of accommodations. In this study, because we're specifically focusing on accommodations, we limit the sample to those who have had at least some employment history. And there is a fair amount of variation in the respondents' employment history with respect to the onset of their disabilities. 34% of the sample was working when we fielded the survey, which was very close to when they applied to VR. 51% of the respondents have worked both before and after the onset of their disability, while 22% have not worked at all since the onset of their disability. To inform the first question, can accommodations address common employment barriers, we asked sample members who were not working, which is the 66% of respondents who said they were not working when we completed the survey. We asked them to report the reasons they were not working. They could report multiple reasons. And we looked at the responses to these questions to see if some of the reasons that the individual stated they were not working could be addressed by workplace accommodations. Non-working VR applicants reported a number of employment barriers. Here we report the most commonly reported barriers. Most respondents, 68%, mentioned their disability or health condition as a reason for not working. While not the most commonly cited barriers, roughly a third cite accessibility and transportation as a reason for not working. These are 2 specific barriers that could be alleviated with accommodations, suggesting that accommodations can address some common barriers. Respondents also cited a number of barriers that are not unique to people with disabilities, such as not being able to find a job, being discouraged from previous employment attempts, and lacking skills. We also found that the perceived barriers varied by type of disability. Those with physical disabilities and multiple types of disabilities were most likely to report their condition as a barrier, while those with psychiatric disabilities were most likely to report not being able to find a job or being discouraged as a reason for not working. Accessibility was reported by a higher share of those with physical and multiple disabilities, while those with sensory disabilities were the most likely to report transportation as a barrier. To see if specific accommodations were associated with higher rates of job retention, we estimated the relationship between employment status at the time of the survey and receipt of an accommodation at their most recent job. So that would be their current job if they were working, or their last job if they were not working. The specific accommodations we looked at were flexible schedule, help from a job coach, modified job duties, help with transportation, equipment or modified workspace, or help from a personal care assistant. When we looked at the relationship between employment and these individual accommodations, we controlled for demographics and impairments. We found that receipt of 4 specific accommodations was associated with a higher likelihood that a respondent was employed when they completed the survey. And those are flexible schedule, modified job duties, help with transportation, or a personal care assistant. But the extent to which any of these was associated with higher rates of employment varied by type of disability. Among individuals with a physical disability only, having a flexible schedule or receiving help with transportation was associated with an 8 percentage point higher rate of employment. You should compare that to the average rate of employment among the sample, which was 34%. So these differences are actually quite large in magnitude. Among respondents with a sensory disability only, help with transportation was associated with an 8 percentage point higher rate of employment at the time of the survey. Respondents with psychiatric disabilities did not have any differences in employment rates by receipt of a particular accommodation. The specific accommodations seem to be associated with the largest differences in employment rates among those with multiple types of disabilities. For that subset of the sample, receiving any one of these accommodations was associated with a significantly higher rate of employment. Our third research question was whether some subgroups are less likely to receive accommodations. And we found that individuals who have physical disability only or sensory disability only were less likely to report receiving an accommodation. Individuals who reported poor health, older individuals, and those that have had their disability for longer were also less likely to receive accommodations. These groups were also more likely to report inaccessibility as a barrier, suggesting that efforts could be made to better provide accommodations to these groups, and if they were, that they might be associated with improvements in employment. To summarize, 1/3 of non-working people with disabilities in our study reported employment barriers that could be addressed by accommodations, such as transportation. Receiving certain accommodations, transportation, flexible work schedule, and personal care, help from a personal care attendant, are positively correlated with job retention. We found that perceived barriers and receipt of accommodations vary across subgroups. I also want to take a moment to discuss some of the limitations of our study and to caution you and how you interpret our findings. Our estimates of the relationship between specific accommodations and employment status are not causal, but rather they are descriptive. For instance, just because a higher share of individuals who receive transportation assistance were still working does not mean that it was the receipt of that assistance that is the reason they are still working. It could very well be the case that if that assistance was taken away, they would not be working, but we cannot assume that if we provided that kind of assistance to others, that their employment rates would increase as well. Nevertheless, our findings have some encouraging implications for research and practice. Our findings are encouraging because they point to specific factors that practitioners and employers can address. First, given the limitations of our study, I want to encourage future researchers to find ways to provide rigorous estimates of the causal impact of these accommodations on employment. Nevertheless, the fact that accommodations to address commonly perceived barriers are positively associated with employment suggests the potential need for additional efforts to expand provision of accommodations. Policies and programs can empower employers to better understand how to provide effective accommodations. And conveniently, our next two presenters are going to talk about employer perspectives on the provision of accommodations. With that, I will hand off to Alex.
All right, thank you so much, Percy. All right, my name is Alex Gouldworth. I'm a researcher at Mathematica Policy Research, and I'm presenting on joint work with my colleagues Katie Morrison and Yanni Ben-Shalom. The title of my presentation is Employers' Perspectives on Accommodating and Retaining Employees with New Health Problems. Okay, I want to start off by giving you a little bit of context about how health problems affect the labor force and the magnitude of their effects. So every year, millions of Americans lose jobs and leave the workforce because of health problems. And this has impacts not only for those individuals who lose the job, but for society as a whole. So these workers experience reduced income, but their employers also face reduced profits, and then the government loses revenue from taxes at the same time as it pays more money in disability benefits and to provide health care. Employers, so actually I'm going to return to this last slide to say that there's robust evidence that when employers intervene early, so when they take action before the worker separates from the job, when they learn of the health problem, they're actually able often to retain these workers. So that leads to my main question behind this study, which is what are those factors that affect whether employers take action to provide accommodations to and ultimately retain these employees with health problems? So to answer this question, we turn to qualitative methods. We conducted in-depth interviews with 14 employers in Arkansas that we recruited through 3 referral sources listed on the slide. And what we did is we sat down with these respondents and we asked them to describe cases when they had employees who developed or disclosed health problems. We asked them to start at the very moment when they learned of this health problem, and then we asked them what happened next. What happened next to understand the entire narrative of how the case unfolded up until the present time or up until the moment where the employee separated from work. Today I'm going to present some of those stories that were shared with me, with you. And in sharing those stories, I want to let you know that the identifying details about both the employers and the employees they discussed have been anonymized to protect confidentiality. Okay, so when employers were telling us about these cases, what types of cases were they describing? We actually found that there was a wide variety in the 50 cases that were described to us. So the employees in each of the cases were in a wide variety of industries, and their occupations varied from being assembly workers to senior managers. And their health conditions also varied. They ranged from cancer to schizophrenia. Some of the employees in the cases were successfully accommodated and stayed at the organizations, while others left because of their health problem or were terminated. So there was a lot of rich variation for us to look at when we were comparing these cases to one another. Okay, so with this broad sample of 50 cases, what did we end up finding? So the main thing that we found is that there were factors on 3 levels that affected the actions that employers took to accommodate and therefore retain their workers. There was a group of factors at the society level, but then the characteristics of their employer, such as the resources available internally to the employer or the communication processes within the organization, those types of factors also mattered. And then the main contribution of this presentation is looking at the factors at the employee level. So the employee characteristics like their tenure at the job, their level of work performance, the type of work they were doing, and the health problems they had. Each of those factors in the individual case affected the actions that the employer took to accommodate or retain the workers. So let's start at the top and talk about all 3 levels of factors. Okay, so at the society level, we found that employers really appreciated the public resources that were available to them. So some of the employers that we interviewed received valuable information and resources from a variety of programs, including DOL's Job Accommodation Network and the Arkansas VR Agency's Stay at Work, Return to Work program. And one of the things that was most valuable about this assistance, these public resources, was the expertise that it provided to employers who might not know what steps to take to accommodate a health problem. So one employer said to us, "I'm not an expert on hearing. There would be no way that I could even say, oh, we need to get you hearing aids. I don't have any clue at all." Another employer echoed, "Having experts there really does help." And then a third employer said to us, "It was very convenient for the representative to come in and provide assistance for us." And then she highlights, "as a free service too." So it was very useful to employers that regardless of their internal level of resources, these publicly available resources were available to all. And that kind of leads me into my next discussion point, which is the factors at the employer level that influenced employers' actions to accommodate or retain workers. So as I just alluded to, ample resources within the organization help facilitate accommodation. So when employers had access to ample resources, financial resources, staff capacity, other private resources like float pools, access to temp workers, company doctors, and employee assistance programs, it was easier for them to provide accommodations. So one human resources director described the efforts that she took to accommodate an employee with a cognitive disability. And she says, "We probably spent at least a year working to accommodate the individual. And we did this despite the frustrations, the hardships, all the extra manpower that was required." So after a year of working to identify and provide the necessary accommodations, this HR director was able to retain the employee. But in cases where there was less staff capacity and fewer resources available, employers struggled more to be able to retain employees. Okay, the second major factor at the employer level that affected employers' abilities to accommodate and retain workers were communication problems. So in identifying and providing an accommodation, an employer has to effectively communicate with a lot of people. So they need to communicate with the employee to understand what the issue is and if the accommodation is working. But then they also need to communicate with HR staff, with supervisors, with doctors, and with insurance providers. And the smoothness of this communication was a key factor that influenced the employer's understanding of what accommodations were needed and how they could best facilitate retention. So to illustrate this, I want to walk you through an example where an employee had an anxiety disorder and an HR staff member worked to provide an accommodation. So the HR staff member said to us that the first person they talked to was the employee, who cited that he had an anxiety disorder, and he presented documentation to the HR group from a healthcare provider, right? So all three of those individuals are involved in this communication process. And then the respondent had to convey to him for the company's position from the standpoint of the company's expectation for him to be able to do certain things. So they told him that they can't just take certain functions off of his plate because they're necessary to his role, but they can modify his work hours and maybe modify the number of supervisees that you are responsible for. So after they've communicated with the employee about accommodations, they then had to engage with his managers to actually provide those accommodations. So this individual, after that smooth communication process, his job duties were modified and he was retained at work. But had any link in this communication chain broken down, it would have been more difficult to retain him. So other employers that we spoke to talked about, for example, not getting documentation from a physician or having difficulty communicating with a supervisor. And those kinds of challenges in communication could really prevent them from being able to effectively provide an accommodation and retain a worker. All right. So let's move on to employee-level factors. As I said earlier, this is the main contribution of this work, that employee characteristics really do make a difference in the actions an employer takes. So we saw that one employer, so the same employer, could take very different action in two cases of employees with health problems. So their actions really depended particularly on the employee's tenure, work performance, role, and the nature of their health problem. So I'll talk through those with you one by one. Okay, let's start with tenure. So in our sample, the 50 cases we examined, employees who had worked at their organization for 4 years or more were more likely to be retained than those with shorter tenure. And one respondent described her decision not to accommodate a new employee who developed a back problem shortly after being hired. So she says, the individual hadn't been with the company very long. That's typically when you're going to see retention not working out, because you don't feel compelled to have to offer as much as you would someone who put in more time with the organization. All right, a second characteristic that emerged over and over again in these interviews was work performance. So employee work performance before the onset of the health problem appeared to affect the employer's efforts to accommodate and retain workers. And in fact, 6 of the 14 employers we spoke with directly cited good performance as a factor that incentivized them to, quote, make more of an effort to accommodate employees. So in describing how good work performance could incentivize them to make more of an effort to accommodate an employee, one HR manager described to us a specific case. So she describes a brand new employee who'd been there only 2 months, so short tenure. She's picking up her twins after school when she has a terrible traffic accident that resulted in multiple surgeries. So despite the short tenure and despite the severity of the health problem, the employee's manager said to this HR professional, I know they don't qualify for FMLA. However, what I've seen in 2 months is the type of employee I want. Whatever it takes, I want them back. And indeed, this supervisor really went above and beyond to retain the employee, visiting them in the hospital, allowing them to take 4 months off to recover. And then once the employee returned to work, she returned with a flexible work schedule so that she could attend her doctor's appointment. And when she couldn't perform certain duties of the job, for example, getting up from her chair to fetch printouts from the printer, the supervisor took over those duties for her, and she was effectively retained. All right, I want to move on to talk about the type of work that the employee with the health problem is performing. It was more challenging for the respondents in our sample to accommodate and retain workers in physically active roles than those in sedentary roles. So one director of HR at a health services organization described feeling like, quote, her hands were tied when a nurse developed a back problem. So because the back problem really interfered with her being able to perform the physical duties of her job, such as standing or lifting a patient, and when there was a communication breakdown about the timeline for return to work, this worker was terminated from her position. All right, so then last I want to discuss the type of health problem that employees had and how that affected whether or not the efforts that employers made to accommodate these workers. So one respondent that we interviewed, and this was echoed throughout, described musculoskeletal conditions and conditions that could be addressed with ergonomic adjustments as, quote, low-hanging fruit. And the reason was that these conditions were relatively easy to identify, and then it was relatively easy to identify the accommodations that could be provided. On the other hand, mental and behavioral health conditions, terminal illnesses, and health problems that hindered the worker's ability to perform basic activities of daily living were quite challenging to accommodate for the employers in our sample. So in describing the challenges retaining employees with mental and behavioral health conditions, one employer said, it is almost impossible to retain employees with mental and behavioral health conditions because I don't think they expect their employer to be acting in their best interest. So when we call to find out how they are doing, they are really suspicious. It is really difficult to get information back. And as we discussed earlier, a clear, smooth flow of communication is essential to providing accommodation. So some respondents went further and speculated that employees with mental health conditions did not communicate with their employers about the conditions for 3 reasons: because of stigma, because of their fear of discrimination, or because they did not realize that accommodations could not be provided. So while some employees with mental health conditions perhaps did not realize accommodations could be provided. Some of the employers that we spoke to were willing to provide these employees with more flexible schedules and shift work responsibilities to reduce stress and accommodate the treatment of workers with mental health conditions. So it seems like there may be a breakdown of communication there. Okay, so we've talked through these 3 levels of factors at the society level, the employer level, and the employee level that are all affecting the efforts that employers are making to accommodate and retain employees with disabilities. But what does it mean for policy? So the first implication, and this has really been well stated many times, is that bolstering employer resources and improving the flow of information within an organization and between organizations and physicians and other parties could help employers to accommodate employees. And then the second contribution of this work is the idea that when early intervention requires employer involvement, so when a policymaker or intervention designer is designing an intervention that requires the employer to help deliver it, they should take employee characteristics into account. Right, so many of these interventions that are designed to keep employees with health problems at work are in fact delivered by the employer or use the employer to link those employees to services provided by medical professionals or case managers. Based on our findings, policymakers shouldn't expect employers to make equal efforts to connect all employees who would benefit from these resources and services to these resources and services. So our findings are suggesting that employers would be more proactive in creating service linkages for employees with longer tenures or stronger perceived work performance, for example. Because of this, policymakers should think about how to connect services specifically to employees with short tenures, perceived low work performance, active roles, or medical conditions that employers find challenging to accommodate. As discussed at the outset of this presentation, both these workers and society will benefit if these workers too stay at work, even if it's not the employer's first instinct to go the extra mile to retain them. All right, so here are the references that I cited in the presentation, some acknowledgments, my contact information. And with that, I will turn it over to Kimberly.
Thank you, Alex. Good afternoon. I'm Kimberly Phillips from the University of New Hampshire Institute on Disability, and today I'll be discussing the 2017 Kessler Foundation National Employment and Disability Survey, Supervisor Perspectives. I would like to thank the Kessler Foundation for funding this research and acknowledge my colleague Andrew Houghtonville for working with me on this. The main objective of this research was to identify policies and practices used by employers to increase the employment of people with disabilities and to get supervisor perspectives on the effectiveness of these practices. We surveyed 3,085 supervisors from across the country. The sample was drawn from a Qualtrics business-to-business panel, and our survey covered 3 broad subject areas: recruitment and hiring, onboarding and training, and retention and accommodation. Within each subject area, we asked about processes and practices as well as their effectiveness. We asked about the commitment of upper managers and the importance to supervisors of the policies and practices. And we asked some open-ended questions in order to obtain specific examples as well as to focus on emerging practices that maybe we didn't know to ask about in the first place. Our sample contained, we focused on employers with 25 or more employees because that is the threshold for upholding ADA regulations. And our sample contained a good range of company sizes, with 22% being having fewer than 100 employees and 35% having 1,000 or more. We asked about supervisory experiences of respondents, including how many years they had worked at their current employer, how long they had been supervising other employees, and how many people they supervised. Within each of these areas, our sample had a good range across the categories. We also asked specifically whether supervisors had supervised people with disabilities of which they were aware or to the best of their knowledge, and we were pleased that 51% indicated that they had. Also, we asked supervisors their general experience with disability, because having a disability or having someone close to you with a disability, we thought, would influence the supervisor's perspectives. So 45% had experience with disability, including 18% who themselves experienced a disability. We hope the findings from this research will inform efforts to improve corporate culture and practices regarding the employment of people with disabilities. In a moment, I'll talk about specific findings, but in general, we found that there are several underutilized but effective practices that are seen as feasible to implement even by those who are not currently using them. We also found there are common practices, that is, things that are used by many, that are seen as effective for employees with and without disabilities, which conjures principles of universal design, reminding us that accessible practices are good for all employees, not only employees with disabilities. And we saw that commitment of upper managers is key for the success of people with disabilities and their supervisors on the job. So let's start by looking at upper management commitment. I'll point out that these are all supervisor perceptions of upper management. So we'll see that first, and then we also asked supervisors about the importance they themselves place on certain policies and practices. In this way, we could look for areas of agreement and difference between supervisors and their perceptions of their upper management. First, we asked how committed supervisors think upper management is at their organization to hiring people with disabilities. And 20% of supervisors felt that their upper management was very committed. Another 45% said that they were at least somewhat committed. And interestingly, the importance to supervisors of hiring people with disabilities closely mirrors upper management's commitment. We asked how committed upper managers were to supporting employees with disabilities to learn their jobs, and 43% of supervisors indicated their management was very committed. However, this was much more important to supervisors. 78% said it was very important to them. 47% of supervisors indicated that their upper managers were very committed to providing employees with requested accommodations. And again, this was quite a bit more important to the supervisors, 66% saying it was very important to provide requested accommodations. Next, I'll talk about organizational processes. We asked a series of questions. First, does your organization have a certain process? And if so, is that process effective? And if so, is it as effective for people with disabilities? And we feel that two of the innovations of this survey are, first, not only asking what employers are doing, but also whether it's working. And second, whether it's working as well for people with disabilities, because this provides us with a very important context to think about our findings. So we asked, does your organization have a process for recruiting new employees? And 84% said yes. Of those, 90% said that their process was effective, and 61% said that it was as effective for recruiting people with disabilities. We asked about organizational hiring goals, and 57% of supervisors said their organization had goals to hire for diversity. 28% had goals to hire people with disabilities, and only 12% said that they included people with disabilities when they mentioned diversity more broadly. So here we see definitely an area for some improvement. Similarly, 74% of supervisors said that their organization spent moderate to a lot of effort in general on recruiting. And 69% spent moderate to a lot of effort recruiting for diversity, and 44% spent moderate to a lot of effort recruiting people with disabilities. We asked, does your organization have a process to support new employees to learn their jobs? And 86% said that they did. Of these, 93%, nearly all, felt that their process was effective, and most, almost three-quarters, felt the process was as effective for people with disabilities. We asked if organizations had a process to provide accommodations upon request, and 66% said they did have a process, and almost all, 96%, felt this process was effective. However, only 59% discussed this process with new hires at an employee orientation or upon hiring. So that reflects back to something that Alex had mentioned, where they may not be communicating this process as effectively to employees as they could. 16% of supervisors said that their organization had a centralized accommodation fund, that is, funds specifically set aside to be used to meet accommodation requests. When they did have this fund, 94% found it to be effective, so this suggests an area for improvement. We can advocate for more organizations to have a centralized accommodation fund. In addition to processes, we asked about specific employer practices. These questions followed a similar pattern. Do you use a certain practice? And if yes, is it effective? And if it's not universal to everyone, is it as effective for people with disabilities? And if people said no, or they weren't sure whether they were using a certain practice, we asked, would it be feasible to implement? For example, we asked, does your organization partner with disability organizations to recruit qualified people with disabilities? And only 27% said that they did so. When they did, however, 95% felt that this was an effective practice. Most also felt it would be feasible to implement. We asked, do you use short-term outside assistance, such as job coaches, to help new hires learn their jobs? And 19% said that they did this automatically. Another 25% said they did this some of the time. In both cases, most people found this to be effective in general, and most found it to be as effective for employees with disabilities. 70% of people not currently offering outside assistance felt it would be feasible to implement. Many organizations offered job shadowing as a way to train new employees. 61% said they offered this automatically. Another 27% said they did this some of the time. Nearly everyone found this to be an effective practice, and most found it to be as effective for people with disabilities. Of the few who did not use this practice, most said it would be feasible to implement. And then we asked about certain accommodation practices. And we found that job sharing, for example, very few are using. Only 13% automatically offer job sharing. Another 37% offer this sometimes, so at supervisor discretion or upon employee request. When used, most people found job sharing to be an effective accommodation, and most people found it to be as effective for people with disabilities. About half of the people who did not offer job sharing felt it would be feasible to implement. Another practice that we asked about for accommodation was working from home, and we asked if employees were allowed to work from home at least some of the time, some to most of the time. and 18% said yes, this was automatically offered. Another 38% said it was offered in some of the cases. When offered, working from home was largely seen to be effective and largely seen to be as effective for people with disabilities. Only, about 20% said that if they didn't already offer working from home, this would be feasible to implement, which of course makes sense. Not all jobs by nature are able to be done remotely. So some key takeaways. To sum up, we found that the importance that supervisors give to hiring people with disabilities mirrors their perceived commitment of senior managers to hiring people with disabilities, which raises an interesting question. If we were able, for example, to influence upper management to put more importance on hiring of people with disabilities, would that similarly rise among supervisors, or the other way around? We also saw that supervisors attach much more importance to supporting people with disabilities to learn their jobs and to provide accommodations than they believe upper management is committed to doing the same. And that makes sense because it's the supervisors who are really implementing day-to-day, supporting the employees, on the ground. Most employers have recruiting and training processes, and most believe that their processes are as effective for their employees with disabilities as for their employees generally. Many, 66% of employers, have accommodation processes, and nearly all believe they're effective, which suggests that support for the 34% who don't have accommodation processes would be time wisely used. Findings about the specific practices also suggest some opportunities. There are some practices that few employers are using, but that when they are used, they're largely seen as effective, and when they're not used, supervisors feel they would be feasible. In particular, partnering with disability organizations in recruiting, offering short-term outside assistance, such as job coaching to help support employees to learn their jobs, and offering job sharing. Thank you.
Thank you to all of our presenters. I'd like to turn it over now to Alan McLean, who will offer his remarks at a broad level and implications for policy. Alan?
Thank you. Thank you for the opportunity to make a few comments. As a vocational rehabilitation director in a state that has made some intentional efforts to provide resources for workplace accommodations, I found each of the presentations very informative and useful as we attempt to educate all stakeholders on the availability of accommodations that may allow a worker to either enter the workforce for the very first time or to remain in the workforce after a disabling condition that's presenting a barrier for staying employed. So as we've discussed a little bit here in the other presenters, if we operate under the assumption that employers and employees truly desire to work together to access and to provide workplace accommodations, then there really are a number of options for available resources, whether it's through a private means or through the public vocational rehabilitation system. Employees and employers can work with professionals in ergonomics and assistive technology to address specific accessibility barriers. In many cases, we have found, as has been presented, that if there is the willingness on the part of employers and employees, then the resources are available for many accommodations that are either free or cheap and simply require a dedicated effort to make them happen and to ensure success. At least for our vocational rehab agency, we have found that the implications noted by Alex and Katie and Yanni in the employer perspective are accurate because we have increased education and awareness of our agency resources, and which has led to us being called in early, which has increased the rate of our successes. I can also add that based on my specific experiences with work-related injury and disability, early intervention to facilitate staying at work or returning to work made a measurable difference in whether or not the employee was able to retain employment. So these successful interventions, while often inexpensive, they do require a fair amount of initial effort on the part of multiple parties. So as mentioned, the flow of communication of accurate information and availability of support is critical to a positive outcome. I know that's been highlighted in the presentations, but from a very practical level, that communication flow is very, very important, and we have seen it firsthand within our agency. In the Mathematica presentation by Purvi, the implications for practice is to a large degree affirmation of some other findings, which heretofore may have been anecdotal, but they strongly make the case for a coordinated effort to facilitate workplace accommodations. And these efforts will significantly increase the number of individuals with varying types of disabilities into the workplace. And I think it should not go without notice that the reporting of 1/3 of non-working people with disabilities reported employment barriers that could be addressed by accommodations, and I think that's a fairly significant number. As I look at the findings from the first study, I do think we are afforded a chance to review each of the employment barriers that were cited. Then as stakeholders and as policymakers, we can make sure there are specific strategies developed around these barriers. Certainly as vocational rehab agencies, we can connect with many of the barriers as we purpose to help individuals become employed and stay employed. So my comments are within the vocational rehab context. However, in many cases, the VR agency role can be that of facilitator and educator, and not always the direct provider of the services. So I'm going to talk briefly about some of the barriers mentioned in that study and how the VR counselor role, the VR agency interacts and can impact those barriers. So the first barrier mentioned was in terms of the conditions. So the VR agency is generally familiar with restrictions and needed accommodations with many different conditions, and how to make a plan for inclusion of individuals with disabilities and those conditions into the workforce. However, though there may be some perceived barriers associated with different conditions, we do find that those conditions are not as significant of a factor as are the individual's clients' interests, skills, and abilities. Then there's the barrier for cannot find a job, and so most vocational rehab agencies have a team or staff that they contract for, or that they contract for services that specialize in finding jobs for individuals with disabilities. So this staff not only works with the individual client with a disability, but the staff also builds relationships with employers to communicate various resources and expertise, and to also learn of the employer needs within the communities and within certain regions of a state. So we very much develop the role of the employer as being a client of our agency, and find that this increases the likelihood of successful employment outcomes. Another barrier was being discouraged, and that the role of the vocational rehab counselor can make a huge difference as they interface with the individual in order to create positive steps toward employment. It is often the primary. The VR counselor is often the primary point of contact in developing a plan for employment or overcoming those barriers, and can point to the various resources that could help with the discouragement. Regarding accessibility, the VR counselor role can be the connector for those consultative services that are of people who are specially trained to assess accommodations and accessibility. The instance, our agency in Arkansas has a team of ergonomic specialists, occupational therapists who are on hand to do worksite consultations and to assist with accessibility concerns, and we found that to be very successful and very, very useful for employers in the state. Transportation also is noted as a barrier. It's a very common barrier that is very difficult to overcome, and again, the vocational rehab counselor, from our perspective, can be a resource for the employer as well as the client in trying to maintain work. Then fear of losing benefits. We encounter this one a lot within our agency as people are moving into the workforce, often for the very first time. The agency resources, the VR counselor can connect the individual to trained professionals to answer the specific questions pertaining to benefits and the impact of earning wages. Many times it's just a matter of understanding those logistics and understanding the necessary paperwork and limitations so that barrier is removed. As I looked at some of the specific practices noted on Dr. Phillips' slide, there are opportunities for many private and public and nonprofit resources to help overcome these barriers, and with intentional actions on the part of any of the stakeholders, particularly employers and employees being on the same page, outcomes will significantly increase. So it is important to remember that strategies for workplace accommodations are relevant to an entire continuum of disability types and scenarios. If any disability is particularly significant, or if, on the other hand, is relatively minor, intentional efforts to accommodate can and should be explored. Additionally, regardless of whether entering the workplace for the very first time or attempting to overcome the onset of a new barrier, those intentional efforts to accommodate are very important and essential. It is noted that some of the data indicate that work experience and duration of employment correlates with the increased likelihood of being accommodated or seeking accommodations. The same resources for accommodation exist for new employees moving into the workforce, and I believe many VR agencies will stand ready to support employers in their efforts to expand their workforce with newer employees as well, and also noting that these newer employees could have a diverse set of abilities and will contribute to the productivity and quality of the workforce. A common theme, again, is the importance of the employer understanding the important role to be played in this process. While there are public resources such as vocational rehabilitation or workers' compensation agencies who offer a great deal of technical expertise, the employer will almost always remain key in making sure an accommodation is considered. Our experience has been that as a public agency, we must stay connected with employers, reminding them not only of certain legal parameters regarding accommodations and accessibility, but also of the large amount of resources available to them in order to make the accommodations work. We also have found the value in continuing to communicate that value message, that employing individuals with disabilities and also retaining them after an injury or an illness can be very good for the bottom line for the business. As a vocational rehab agency, we have found it strategic for us to communicate this message and facilitate accommodations as we see it advancing our charge to increase employment of people with disabilities that are in competitive settings and integrated settings. So thank you, and that concludes my comments.
All right. Thank you, everyone. We look forward to answering as many of the questions as time will allow. As a reminder, please use the widget to submit your questions, and whether posing a question, be sure to state your name and affiliation. Carmen, do you have questions that we might be able to ask to the speakers?
Yes, I do. This question comes from Joanne Schneider from the Chrysalis collaboration. Does psychiatric disability include intellectual and developmental disabilities?
This is
I think
Purvi.
this question came in for Purvi. Yeah. Go ahead.
Yes, I can address that question. The survey that we used in our study does include individuals with intellectual and developmental disabilities. However, when we define psychiatric disability, it does not. We do not include individuals with intellectual and developmental disabilities. We don't present estimates separately for IDD because the sample was too small to report separately for individuals with IDD.
Okay. So the next question comes from Gina Livermore from Mathematica. What kinds of accommodations are employers most resistant to implementing, and why, aside from the high-cost one?
Anyone want to take a stab at this?
Could you repeat the question one more time? I'm sorry.
Sure. What kinds of accommodations are employers most resistant to implementing, and why, aside from high cost?
This is Alex. I can chime in response to that from the qualitative findings. So interestingly, cost didn't come up as a reason that employers talked about not accommodating and retaining workers. In the cases where they had to purchase equipment or things like that, in most cases they found the cost to be easily absorbed. I suppose you could think about covering employees during their absences as something that could be addressed through cost if a temp worker could be hired, but I think that was something that employers really struggled with implementing is coverage when employers had to miss work due to doctor's appointments or not being able to get out of the house and to work. But I think also even a bigger barrier than not wanting to provide an accommodation that they knew could solve the problem was just not knowing how to accommodate the condition, either because they couldn't think of a solution or didn't think there was a solution or felt that the employee was difficult to work with in implementing that accommodation.
Okay. Question comes from Todd Honeycutt at Mathematica. Do any of the research findings suggest the extent to which employees and employers know where to go for help with accommodations?
Hi, this is Kimberly. I can say a little bit. I don't know if it's going to be a direct answer for you, Todd, but we did not ask. We thought about asking about employer/supervisor knowledge of specific resources that could be consulted at a national or federal level, and we chose not to ask those questions, but the most recent work coming out of Cornell found that most employers reported that they were aware of resources that they could consult regarding accommodations for employees with disabilities. And that's one of the reasons we chose not to ask it, because the finding was pretty across the board. It looked like employers were saying at least that they had that information. At the same time, our findings that processes to request accommodations are not always being shared with new hires, for example, suggests that employees may not know always who to turn to for assistance, and the fact that few supervisors said that they partner with disability organizations to recruit qualified employees with disabilities also suggests that, maybe knowledge of resources isn't quite enough for employers to know where to get help.
And this is Alex. I can chime in to kind of add to that from the qualitative findings. So one thing that was kind of interesting for us is we did ask about this, and now we recruited through organizations that could be resources, so a professional organization and the Arkansas Rehabilitation Services. So not surprisingly, the employers that we recruited through ARS said they knew to go to ARS. And both respondents recruited through professional organizations and not did talk about going to like human resources professional groups and learning about resources for employers with providing accommodations in that way. And even some of the employers that learned about ARS learned about it through these conferences or meetings or email announcements from their professional groups. But yeah, but I guess there wasn't, outside of that, people really did talk about a lack of information and a lack of knowing exactly what to do and who to go to for help. And of course, our findings don't speak directly to the experience of employees.
Okay, on to the next question. This question comes from Amanda McDonald, a training coordinator at St. Luke's Hospital in St. Louis. What are some ways to incorporate knowledge and education about accommodations into the workplace?
Alex, I don't know if you have anything you want to add about this.
Sure. I mean, I think that our findings kind of speak to the importance of, well, since we interviewed HR professionals, we learned that it's important for HR professionals to get this information and to learn more about these best practices and then diffuse that downward. And like I spoke about earlier, we did see places where there was disjuncture between frontline supervisors and HR. So HR might hold information about accommodations, but not transmit that information to supervisors, and then supervisors might not implement accommodations or turn to HR for help when that's necessary. So I think that one key thing coming out from our study is kind of sharing that information broadly across all staff in an organization is a place where there might be room for improvement.
Okay.
Alan, do you have anything that you want to add?
Well, I was just thinking as Alex was talking, again, we're obviously within state government here and provide resources to everybody in Arkansas, but to develop a model to do it better, we have developed a program just within state government to work as a subset to train supervisors, train HR professionals, just within the subset of state government on how to deal with accommodations, how to address staying at work and return to work for individuals with all kinds of disabilities. And the governor himself has made it a priority to hire individuals with disabilities to begin with. So we are seeing some leadership at the top on it here in Arkansas.
Okay, Alan, I have another question for you. This one comes from Dave Stapleton at Mathematica. Because of limited resources, VR agencies often must make difficult decisions about which applicant they should serve first. In Arkansas, does the fact that the applicant already has a job have an effect on whether you serve them? And do you know if your state's approach is common or uncommon among state VR agencies?
Right. Appreciate the question. And no, it does not have an effect on whether we serve them or not. many states, VR agencies are under what's termed an order of selection, which requires a prioritization of services. And in Arkansas, we're not on an order of selection. But in terms of vocational rehabilitation services, generally speaking, job retention services, as my understanding, even if you are on order of selection, then we can still serve them without prioritizing them. Some of my colleagues may check me on that, but we don't have to deal with that here in Arkansas. We can serve everybody who walks in the door.
Okay. The next question comes from Sarah Isaacs. In the beginning, you mentioned agencies that provide free consultations to businesses to advise them in accommodating employees. Was that state VR agencies or some other agency?
This is Alan, and I'll start with that, and others can jump in if they want to. But my point of reference for that, the answer to that question would be the state VR agencies. My experience, and just again within other states and other state agencies, is that there are similar services that for agencies whose mission is to help with workforce issues. So state workers' compensation agencies often have a role and provide consultative services in being able to have some disability management, return to work strategies. But certainly the VR, primarily speaking in context of the VR agency and as providing free consultations, absolutely.
And this is Alex. I also just wanted to chime in and say that one employer we interviewed found that DOL's resources, the Job Accommodation Network, was particularly helpful. And Alan, I know that you have more expertise on those resources than I do, but I just wanted to mention them.
Okay. Next question comes from Christy Fuller from Georgia Health Policy. An opportunity for increasing individuals with disabilities in the workforce includes partnering with disability organizations for recruitment of employees with disabilities. What organization types or specific organizations are available to support this type of recruitment?
Kimberly, did you learn anything from your work? It seems like you did the most on the recruitment side of things.
Hi. Yes. Well, we didn't propose examples for our survey respondents, but I think in New Hampshire for that kind of assistance, we would look to our centers for independent living. We would look to our DD agencies. Our aging and disability resource centers would be able to help with recruitment. And I don't know about state VR agencies, but perhaps someone else could comment about that as a feasible possibility.
This is Alan. Yes, state VR agencies. And we, as a VR agency, we partner with a number of community rehabilitation programs who have as part of their mission to train. They're vendors for us to train individuals with disabilities and are often in the communities throughout the state building relationships with employers in order to provide competitive employment in those areas. Nationwide, organizations such as Goodwills or Easter Seals or organizations such as those that have a focus on working with disabilities and particularly employment focused or have been good partners, as well as the Centers for Independent Living that you mentioned.
Carmen, do we have more questions?
We do. Sorry about that. This question comes from Randy Kaiser. How does your research apply to the notions of employment first or meaningful days for persons with intellectual and developmental disabilities?
Do any of the speakers want to take a stab at that?
Sure, I can take a stab at it. So, so the notion of employment first is that it's basically centered on the premise that all individuals, including individuals with even the most significant disabilities, are capable of participation in integrated employment and community life. And at the beginning of my presentation, I talked about sort of two models of research on disability and employment, and that the social model of disability recognizes the fact that there's many factors in society that can influence whether an individual with disability is able to work. And that's sort of part of the motivation for our studies, to think about what are the factors that are presenting as challenges and what can be done to relieve those challenges. I don't know if anyone else has anything to add.
This is Alan. I'll just chime in one more time on with regard to employment first. Our agency, as a VR agency, does partner with other state agencies, particularly the human services agencies, to promote every effort for it to be for having competitive and integrated employment outcomes. So there is a lot of efforts that go on to that everything we would do would apply to the notions of employment first, because that's sort of the cornerstone of it, is competitive and integrated employment.
And this is Kimberly, and I would also say that we tried to address some of these notions in the very design of our survey by asking questions about employees in general, thereby suggesting to supervisors that, like universal design, but that being an integrative, accessible employer is good for everyone. And also, oh my gosh, I'm so sorry, I completely lost my train of thought right there.
Well, why don't we move on to the next question? This one comes to Alan. What tips would you, Alan, give to other VR agency directors who want to replicate their efforts with employers?
Good question. The first tip would be to develop a good employer network within your state, to get their input, to develop those relationships, to let them know that they are clients of your agency as well, and let them experience that, so that they're sensitive to they know that you're sensitive and recognize their needs. So developing a employment relations team of individuals who build those relationships would be a great first step in doing that. And it does, to do that step, it does require a certain amount of capacity that a lot of agencies may not have, and may be easier said than done. We, over the years, have developed a team of people only dedicated to building employer relations, but they also are charged with matching our clients with jobs in those employers, and so they have a real results-focused mission. But core and key to it is understanding the needs of the employers throughout the state and maintaining those relationships. We have employers on our state rehabilitation council who hear our strategies quarterly and give input on how best to serve them. And then we're involved in their organizations as well.
Okay. Next question to Alex. So this was a helpful presentation, but there's a particular point. You noted that workers who had been on the job longer received accommodations, but what about those who are new disability hires that need accommodations to get started? What happened in those cases, particularly with the frontline supervisors and colleagues responsible for implementing accommodations?
Well, this is a really interesting question. I don't know the answer to it because our goal with this study was to really understand what happened when there was an employee that had been hired without the employer knowing about any health problem that require accommodations. So some employers did want to speak with us about these issues in times that they had provided accommodations to new hires. But we asked them to focus on cases where the employee had been working for some period of time before they developed the health challenge. So unfortunately, I can't speak to this.
Okay. Next question comes from Sandra Silverman. At any time, were there any references regarding equal employment opportunity complaints based on disability and possible impact on the decision-making process regarding accommodations?
Alex, can you speak to whether that came up in any of the interviewers you had with employers?
Yeah, so it wasn't about EEO complaints specifically, but one thing that was kind of interesting, and I don't know that it made it into the paper exactly, but we did notice kind of two groups of employers that we were talking to, some that were very focused on compliance. So while I don't know that anyone mentioned EEO, there was a lot of discussion about FMLA and ADA and just doing the things that were necessary to maintain compliance with the statute and not doing anything that might, for example, violate HIPAA or other kind of regulations, and that was a big focus. And then there was another group of employers that seemed very focused on providing the accommodation. So they were less interested in possibilities about any complaints or problems and more focused on kind of doing whatever it took to accommodate the employee. So I think this question is particularly interesting because I interpret it to be about, how does the kind of threat of sanction affect employer behavior? And I would say that with this compliance-focused group, a lot. And people were really focused on what they needed to do to maintain compliance. But in some cases, it was unclear to me whether or not that was a double-edged sword with either people stopping short or once they'd maintained compliance but not done all they could, or I guess the way it would be a double-edged sword was the ways in which these regulations sometimes hindered people from getting the information they needed, for example, to provide the accommodation. But that's a very complex issue, but it was pretty interesting to see these two different kinds of approaches to thinking about the task at hand.
Alan, do you have anything you want to add there? The things you've learned from employers or, concerns about litigation or EEO complaints?
No, I really don't. I don't really have anything to add to that. I think Alex covered it.
Okay.
Okay, let's go to the next question. This is from Jared Pena, voc rehab counselor from Idaho. How can employers accommodate the need for transportation for people with disabilities? Is that even possible?
This is Alan, and I'll mention something. Others can jump in as well. And my observation on that is that employers can just be helpful. I mean, that they can help find the resources for the people with disabilities. They don't have to, not necessarily in all cases are they going to provide it, but I think that don't always just shut the door because that's the one barrier. That's really all I would have to add to that. others may look at that, but it's definitely a barrier to staying employed.
Irvi or Alex, your studies seem like they may have touched on that.
Sure. I had some thoughts to share. The first, and this wouldn't apply to many jobs, but there's been an increase in employers allowing people to work from home, and that is a way of accommodating transportation barriers. So obviously that wouldn't apply to many kinds of jobs, but it would be helpful in addressing transportation barriers for some kinds of jobs. The other thing I was going to mention is that, I've definitely heard a lot about transportation barriers, especially in large rural states where public transportation might not be available. But even in cities where there are accessibility services, transportation services, they're often unreliable in terms of timing and being accommodating with respect to timing and delays when workers are getting transportation assistance through these services is also a way of being helpful, as Alan said.
I agree, and I've had hand experience as an employer on that, where we had an employee who was all of a sudden, due to a stroke, they were reliant on public transportation. They could do their job mostly, but they couldn't drive, and the unreliable nature of the public transportation you mentioned was a significant barrier, and we accommodated her schedule. We didn't provide the transportation. She paid for it. She arranged for it, but we did have to be accommodating in the way you're talking about.
Alex, did you hear anything from employers that might help on that front?
I didn't have any employers directly speak to that issue, but yeah, I think the timing is really key.
Thanks.
Okay, on to the next question. This comes from Tara Vitone. She's a job developer at Pride Industries in California. Are you finding that DOR or Department of Rehabilitation vendors such as Pride are having more favorable outcomes or placements versus DOR consumers that are working solely with the Department of Rehab and not using outside vendors where they can be provided more one-on-one support?
Alan, do you have anything?
I don't have all the data to answer that question, really, but vendors such as Pride do have very favorable outcomes. I do know that, but I don't really have the comparison data to answer that. It's a good question. I'm going to look it up myself.
All right. And with that, we've reached the end of our time today, and thanks to everyone who participated on the webinar. We hope you've enjoyed today's discussion. If you have any additional questions, you can feel free to reach out to me. My contact information is in the slide shown, or you can use the feedback survey that you will be sent. We've recorded a list of the questions that we received that we didn't have a chance to follow up, and we'll manage to track you down after the webinar to follow up. Please be sure to let us know how you think we did by completing the electronic survey, which is available to all webinar participants at the close of the session. And again, thanks for participating. We look forward to talking with you again soon. Take care.